The United Arizona Firefighters Healthcare Trust, founded in 2014, serves the unique health and medical needs of active and retired firefighters. Sponsored by the Professional Firefighters of Arizona, the trust is specifically customized to offer insurance coverage unique to firefighting and the stress put on firefighters' bodies by the job. This includes advanced forms of cancers, serious cardiac issues, and the potential for shorter life expectancy. How can firefighters benefit by participating in the United Arizona Firefighters Healthcare Trust? One unique aspect of the trust is the Retiree Healthcare Subsidy benefit. This subsidy is like a smaller version of a firefighter's pension. Participating firefighters make pre-tax contributions to the trust on payday. Employers who have committed to funding the trust through their MOUs make pre-tax matching contributions. These contributions are pooled and invested in a diverse set of mutual funds, equities, and other investments that are professionally managed. Like a pension plan, the trust will experience fluctuations over time. The trust board has been conservative in its assumptions and hopes to see the trust fund grow at a productive rate moving forward. Once the firefighter retires and meets the trust's eligibility requirements, the retiree will receive a monthly stipend to help cover healthcare costs. This benefit is tax-free so long as the stipend funds are used to pay IRS-designated medical expenses. Eligible medical expenses include health and dental expenses, eye care, prescriptions, payment of health insurance premiums, and copays for doctor visits and hospital stays. If the retiree does not use the stipend payments for medical expenses, he or she will receive a 1099 form from the trust and the money will be treated as taxable income. Currently, fire departments from 7 Arizona municipalities and fire districts have joined the trust. New groups that elect to join the trust have the ability to customize their retiree subsidy benefits. This includes how long the subsidy will be paid, typically until age 65 or for life, and the size of the subsidy for each retired firefighter. Members who make contributions but do not stay in the trust long enough to be vested will receive their money back with interest paid at a rate determined by an actuary. The repayment will be made when the trust matures and the member reaches his or her retirement age per PSPRS requirements. Members who reach vesting but retire before the trust matures will receive the benefit plus back pay to the date of trust maturity or their retirement, whichever is closer. The United Arizona Firefighters Healthcare Trust's retiree subsidy is an excellent way to make staying healthy and getting the medical care a firefighter needs more affordable in retirement. By investing early, lowering your tax burden, and planning for tomorrow, the soaring costs of healthcare for retirees can be made more manageable and less of a burden for firefighters and their loved ones. Here's an example using the trust's agreement with Tempe firefighters. A 25-year-old is hired by the Tempe Fire Department. Each paycheck, this firefighter contributes $25 in pre-tax money, a contribution matched by the city of Tempe. Over the course of a 25-year career, this firefighter will contribute $16,250, not counting the city's matching funds. When the firefighter retires at age 50, the trust will pay him $330 per month to subsidize his medical expenses, tax-free. If this firefighter lives to age 80, he will have received $118,800 in tax-free healthcare offset funds from the trust. In this example, that's more than 5 times the firefighter's original contribution. The United Arizona Firefighters Healthcare Trust helps our members protect their health and protect their financial well-being in the years after they leave the job. For more information or with questions, contact 602-675-4764. The United Arizona Firefighters Healthcare Trust.
All right, so for those of you that don't know me, my name is Jongewaard. I was hired back in 1994 for the Tempe Fire Department, spent almost 31 years there. Left as a captain paramedic, BSO, and was the chapter president for 13 years, and president for another 15 before that. About guesstimate. So 20, 25 years. So they were leader. We left the city's healthcare plan a while back. And we back up before that. Phoenix had a thing called the MERP. They call it the MERP Medical Expense Reimbursement Program. So we piggybacked onto that, which is the substance of what I'm going to talk about here. This program that you guys wanted to hear more about. It is a retiree healthcare pension. Simple as that. So we started that back in like 2008. Yeah, we funded it. It's an all in, all out. Right? It's not a voluntary thing. Voluntary doesn't work. It's like a pension. Everybody's in, everybody's out. We started with $25 a paycheck coming out of our paychecks and going into this fund that was being invested by Northern Funds. The city matched it with another 25. About 4 years ago, we raised it to $50, a $50 match. We had to let that money mature. Time is your friend in this. This is not a benefit where you say, hey, I'm retiring next week. I want to get in this thing. Here's my 25 bucks and I'm going to go get a benefit when I leave. No, this is a pension. You got to put in your time. And I'll get into the issues that we had to tackle and where people were in their career and the options that we did. But basically, in the summary of this is a healthcare pension. This is money that has to be used for medical expenses. According to IRS qualified medical expenses. There's a ton of them, a whole bunch of them. So in order to use that for medical expenses, we're going to send you at the end of the year, after you get your distributions, you're retired, we're distributing money to you, a monthly check. We're going to send you at the end of the year a form that says, we gave you X number of dollars. How much did you use for medical expenses? And you're going to say 100%. You didn't do 100%. Whatever you didn't use it for medical expenses, you're going to get a 1099, you're going to get taxed. We are a tax exempt trust. It's not, in order to remain tax exempt, we have to follow the rules, we have to follow our definitions. So basically it is a pension. So in Tempe, what we did is we started with $25, we let it mature for about 12 years. It didn't pay out. And then when we came to a time that we could do distribution, we had an actuary run the numbers again. And we started off giving $130 for our tier 2 people. And our tier 3 people had a different retirement benefit that they didn't get as much from the city when they retired as a tier 1. So we gave them $330. Since then, we went up to the $50. We redid the actuary after a couple of years of doing the $50. We went to a model that I think is better, and it's $18 per year. $18 per month per years in the plan. So if you're in the plan 10 years and you leave, and yours is what we say is vesting, you don't get a benefit until you do at least 10 years, you get $180 a month the rest of your life. And that $180 is you spend it on whatever you want. We're just sending you a check. But technically, it's to be used for healthcare expenses. And if you don't use it for healthcare expenses, we send you a 1099, and you get taxed on it. Go ahead.
Is this kind of like a high deductible health plan in the way it functions?
It is not. So an HSA, health savings account, is always attached to a high deductible health plan. Totally separate. I have an HSA as well. But no, it's a totally different deal. This is a subsidy. It is, we're not asking for reimbursement. We're not having to file receipts. We are sending you a check every month, like it's a pension, and you're using that money. You're calculating your medical expenses, and let's face it, if you're a retiree and you're going to go as retiree only to the state plan, and you're going to have a premium of $1,100 a month for a high deductible health, right? That's a good deal, right? You've got a family, you go up to $3,000 a month. you have to plan for healthcare expenses when you retire. Retiree healthcare is more expensive than active group. Just because you're older, you have more problems. Statistically, you cost more, right? We also have a healthcare side of things that we do. We offer healthcare benefits, including the retirement plan. And that was the idea, was to mesh this all together.
What's the cost of your guys' healthcare plan?
On ours, depends what plan you go with. We offer a $900 deductible PPO plan, and we offer a high deductible HSA plan. You're responsible for funding your HSA on your own, but we don't. Employer match HSA, sometimes we don't have to. In the future, we may be able to coordinate with this benefit, have it fund an HSA for you, but it's 6 of one, half dozen others doing the same thing. You know what I mean? I don't know that there's a big benefit. But you're looking anywhere between, for like retiree only, somewhere between 900 and 1,500. Now you'll get what they call the PSPRS premium benefit. Premium benefit is not a subsidy. You never see the money. It just comes off the premium. It's a discount. It's like a coupon, right? Gives you a discount on your premium. So currently PSPRS's premium benefit is $150 for retiree only, $260 if you have dependents. So if you're at $1,000, $850, you're a retiree only. That's what you're actually gonna pay, because PSPRS is gonna pay us, the insurance company, the full premium, but take out of your pension check $150 less. Make sense? That's how a premium benefit works. As opposed to a subsidy. Subsidy is gonna give you a check.
Yeah.
Whereas our plan, when we talk about the subsidy, the pension benefit for the healthcare pension, that is a subsidy. We are mailing you a check. We're not telling you what to do with it. We're not asking what to do with it. The only thing we say is use it for medical expenses. And then give us a form signed that says we used it for medical expenses in a year. So if we get audited, we say, he said, she said, medical expenses. Right? Because we're what they call a voluntary employee benefits association, it's called VEBA trust. We have a very defined definition. That definition is an Arizona government employed firefighter or PSPRS or SRS. Right? That way, when we brought in our like civilian medics and stuff like that, we were able to do that. So if we're allowed to go 10% outside that definition. As the trust as a whole, so that includes our groups that are in the healthcare side, as opposed to including the groups that are on our pension side, right? Why that's significant is because we have mostly fire districts on our healthcare side. And imagine you're at a fire district, you have 100 firefighters, and you got 5 admin staff. You're not going to box out the 5 admin staff on their healthcare, and tell them to go get their own healthcare because they don't meet the definition. That allows us to, that stays us in that 10%, right? And when we count the trust as a whole, that 10% is a pretty good size number. Currently on the active healthcare side, we have over 1,000, so it's about 3,000 lives we cover. And on the pension side, we're probably close to that same number, about 1,000. Each group sets up their own contribution agreement with the help of us. I'll sit there with you and with the actuary and the accountant and say, here's your options. It can be sustainable. This is the one we're doing for Glendale, the actuary. Look at it if you want. I'll pass around. Let me take the pages that have all the names and social security. But if you guys want to look at that, pass around. If that's what the actuary looks like, actuary gives them 3 or 4 different options to say, hey, you can do a 5-year vesting. You could, just the amount of time before a person's eligible for a benefit, and you can allow the fund to mature for 10 years, 5 years, whatever it is. All that stuff affects what your benefit can be, a monthly benefit. Time is on your side. The longer you wait and the more money you put in, the more higher benefit you're going to get. Simple as that. The shorter amount of time, the sooner you want your money, and the less amount of money you put in contribution wise, the lower the benefit's gonna be. Like I said, in Tempe, we get a good benefit. We get members at $18 per month. You're getting members between $330 to $680 a month. Offset their medical costs. Now you add the dependents, another $260 on top of that. $150 if it's just retiree only. You're getting over half your premium paid if you're a retiree. And you do the maximum amount of years. Make sense so far?
So this is this just for members or does this include our chief staff? And if it doesn't include our chief staff, Roland here is a firefighter, he's gonna promote to captain, he's gonna be that time eventually. Does he get X out of the plan?
So you never get your money, you never lose your money. You never lose your money. Not the employer money, the employer money belongs to the plan. Right? So your best. So it depends on when you leave, when you promote. Got a phone call this morning, you guys gonna call Carmen? Call Carmen's up for becoming an assistant chief. Assistant chiefs aren't covered in the plan, they're not covered in the contract. So he has three options. Look to see how long he's been in the plan and take a lesser benefit. You know, as long as he's got over 10 years in the plan, 10 years is vesting. Take his money out with the actuarial interest rate. Employee money with an actuarial interest rate, that the actuary will figure all out. Or pay the employer's contribution as well and stay in the plan pay. But we don't care, as long as the amount that's in the contribution agreement is being contributed. So if you say, hey, I pay $50, my employer pays 50, I'm gonna promote outside the group, I'll pick up the whole 100. Because until we can negotiate a deal that the employer picks it up. So there's options like that.
That could be an option where the
Right.
city would pick that up, but it would have to be then.
Now, because of our definition, we would want something from the union president saying he's in good standing with the union, he's left in good standing. You know, we're not here to box people out, but we are here to protect our tax exempt status. Because if we become a tax trust, we're close shop.
Tony, I might be missing something. So this is like it is a health reimbursement account, but is there? How does it help with? When you have to get qualified expenses and everything, some of those qualified expenses, if you don't have an insurance plan, those qualified expenses, obviously you pay the entire amount with the market value of that service.
You're gonna get, if you get audited by the IRS, it'll be your responsibility to show your receipts.
Okay.
Right? You're gonna get a check for $200 a month. And at the end of the year, we're gonna send you a form. You can access it on the website. Or an authorization form or certification form. I certify that. I spent X number of dollars on premiums, X number of dollars on prescriptions, and X number of dollars. You want to equal 100%.
Okay, so you would go outside, you'd find your own healthcare coverage
Yeah,
again.
we're not keeping track of it for you.
Okay.
You know, technically, could somebody use the money for a boat payment? Yeah. Technically, could somebody use that for a boat payment? Send in a form that says I used it all for vehicle expenses? They want, probably. If they get audited, no one's gonna get in trouble with that, it's not since we're gonna, since you certify, you use.
But there is, that's what I'm confused about is there, does Tempe have the post-retirement health plan that this helps with? Does Tempe have a?
No.
I understand you had a co-op that kind of a healthcare co-op that you formed.
Yeah, we form a trust and we have groups that have joined, but each siloed has their own contribution.
Okay, but within those contributions.
Pension check. Don't confuse it with healthcare.
That's what I was trying to
It's
say.
not tied to any healthcare.
Okay, so you can use it for your healthcare and everything.
You have, it's money that you will not get taxed on right? Came out of your paycheck pre-tax. You use it, you don't get taxed on it because it's for medical expenses.
It's,
And yeah, you get a pension check every month.
okay.
That is to help you offset your expenses that you're going to incur, whatever they are.
Okay. That makes sense.
And the only thing you have to do is go to the IRS website, type in qualified medical expenses, and this giant list comes. And you have a medical thing, I wonder if this is covered, you go, found the list. I'll give you an example. I know guys that have gotten their wife's breast implants. He claimed it. Was it on the list? I don't know, look. They get audited, it's not on the list. They're gonna get taxed on those implants. So my wife got veneers. Right? So what happens when you get over 55 and start getting stuff like veneers. My wife got veneers. And she used our HSA card, pay for them. You just got notified, it's not a qualified expense, they pass on.
We have a hand raised. Bolin, did you want to say something? We can hear you. Gotta unmute yourself. Bolin, you there?
Let's see. Yeah.
They sunset it, so it doesn't break, set it alive and it's.
You're always good someone.
You get it. That's what the works.
Bolin, you there?
Yep, I'm here. Can you guys hear me now?
All right, go ahead and tell me and I'll, if it's not loud enough, I'll send it
Okay.
over.
During part of the presentation, it got a little garbled with the connection. But if I remember in the beginning, you were saying that you have some districts that are involved in this that say they have like 100 firefighters and their chief staff is around 5, and we didn't exclude those. So this is piggybacking onto the scenario that Eads had talked to you about. Roland's a firefighter right now, has aspirations to promote through the department, as do I. If I am completely vested in this and at some point potentially get to a chief level position, we couldn't hear what your answers were as far as other than you never lose your money, but it was all garbled after that. We're just curious on if someone gets to that level, they've done their due diligence, they've paid everything, they're in good standing. Are they out on the monthly distributions, or how does that work? Or is that something that can be incorporated in, since there are fire districts that have their chief staff on this?
Right, now, when we say fire districts that have their chief staff on it, we were talking about the active healthcare plan. Which
Okay.
is medical, dental, vision that we offer. But to answer your question, there would be options.
Okay.
Those options are based on whether the person is vested or not vested. How long they were in the plan, what the contribution agreement says. But in general, I'll tell you, buddy Kyle's issue that he called me on this morning. He's thinking of promoting. His options are going to be, if he's not vested and doesn't have enough time in the plan, he take his money out, gets his employee contributions back, plus an actuarial assumed interest rate based on what the market's done over that time. He does not get the employer money back. The employer money belongs to the plan. If he is vested, he can say, okay, this is like me retiring. I'll take my benefit based on how many years I was in the plan. And even though I'm going to keep working, I'm going to get that benefit as if I retired on that day. The third option is, if I put $50 in and my employer was matching 50, and now I promote, my employer says, hey, you're not in that negotiated group anymore, so we don't pay that benefit to you anymore. You can pay the whole 100 and stay in the plan and keep accruing more years.
Okay, that makes sense. So that way you're still going to reap the rewards at total end of career.
Yeah, you're going to get something.
Okay, so I understand correctly, if somebody did get promoted to the chief level position, the city doesn't do their matches, that chief level officer is then making essentially both those contributions.
Mhm.
At the end of their employment, would they still get 100% of what they were going to
They're
get
gonna
if
get
they're
what their
capped at the
benefit
wall.
is calculated at as if they were they never left the plan.
Perfect. Okay, cool. I understand completely now. Thank you.
Our biggest deal is we want the whole contribution to come in so that our actuarials aren't thrown off.
Yeah, I got you. I just, like I said, it was a little bit garbled when we were going over the options and just wanted to get clarification. Thank you.
Yeah, no problem. This was my before is it's a very simple question. The thing that gets us is when you're starting this. You're starting this not for the guy that's going to retire. You're starting this for the 20-year person who just got hired. Right? You started this for people that are going to do their time. Now, are we going to make even? Yes. You get your money back? Yes. So in 10 days, we had 3 things, right? We had a group that was gonna put some money in the plan and retire it, never be invested, and the fund was never mature enough to start paying a distribution. Right? So with those people, when the fund became mature enough, which for some was 10 years later, right? We notified them and said, hey, sending you a check for $4,000. These are your contributions plus the interest. Whatever the number is, the account keeps track of it. Right? That was one group. We had another group of people that were vested, but left, retired before the fund was mature to pay. What do we do with those people? Well, when the fund was mature enough to be able to start doing distribution, we called them up and said, hey, you're going to get 2 checks. One check is going to be your back pay, for as if you were getting your distributions from the day you retired. And your other check is going to be your monthly one. It's going to come every month. And then the third group is the obvious group. They're vested and the fund was already mature and they did their time and they're getting their money.
So, like, someone like me, I won't be here 10 years, I may have 8 years left, so if you have to have 10 years, what's the hell?
So it's the other thing you can do. You can say, okay, people that have 10 years left till they retire, that's the line we're going to draw. They're going to contribute. This benefits for them. People that have less than 10 years or wherever you want to draw the line, you don't contribute. You don't get the plan. The only bad thing that does is it's just less money getting invested. You know. But for someone like you who says, I don't want to give I don't want to give them the next 2 years make $25 a month. You know? And then that's something you're going to have to figure out. The contribution agreements are customizable up to a point. We're not going to let you take a benefit that's not sustainable.
You can't make the 10-year mark, you're just out.
There are groups that did that. Mesa did it that way. Then Mesa got their healthcare thing and they ended up pulling out.
I think that might be hard for us, Shay, because we have such low numbers. I think what we're looking for in our MOU is for 100% contribution. Otherwise, I don't think it'd be sustainable because we have enough people leaving within 10 years that we would almost have to have everybody invested. So
You're not seeing where that person leaves, kept paying into the trust, or the trust mature.
When that fund gets mature, I want my benefit, and it'll pass as your years in. All we care about is we're getting the contributions in, and however many years you're in the plan, you make contributions, is going to be the formula we're going to use to figure out what your monthly benefits are.
So if I retire in 8 years, I can still keep paying until 10 years.
Yeah, retire, you did this for a year, and you can keep paying into it for another 10 years. We don't care. The issue is when we set up a group, we get it from payroll. Now we're going to be doing ACH.
But if she retires at 8, can she just do a lump sum out of her drop money or whatever and not have to pull them?
The actuary say does this. And if so, how much is that? What, you know what I mean? Exactly. Yeah, right.
Now, what if somebody puts this as a say microphone put in? I retired 2 years, God forbid, I die, there's obviously a beneficiary, so it's the wife would get.
Beneficiary is a line of duty. If you die while you're working.
No, so, but what, I was retired,
If you retire, the benefit does not continue to your spouse.
okay, so that money's.
We can set up in your contribution agreement, but your benefit amount that you're gonna get is gonna go. Every factor affects the other. You can do just about anything. It's just whether you're gonna get some other benefits gonna be, you're gonna get a $600 benefit till you die, or you're gonna get a $100 benefit until your wife dies.
And Shay, how these proposals are being written, it is 100% participation rate. So if you're a union member, this will be mandatory.
We have one voluntary, they're trying to get out of it, but they lost their MOU and it's killed. And it's a mess, and we may be cashing them out, that's what we fix. But for one, we're not supposed to have a representative business meet and convert. Because we're a union trust.
If it's 100% buying, we've gotta write that language to where we got a whole bunch of stuff to figure out.
We have that language in there right now.
Most of Sweden.
Yeah, well, and I think it's important to know, and he touched on it, is you're here for 2 years or 3 years, however long, the money you're contributing, that's not money gone. You get all that back with interest. The only thing you're losing is the city contribution. So that's what we're really asking members that are here 2-3 years.
If that's what we're gonna ask them when we just present contribute some.
A portion, yeah, it'll be a match, so 50 and 50. So that benefits our longer members more than it would matter.
The other thing you can do, what Peoria did, and I think Glendale did the same thing, if I remember correctly. I'm confused. Is when they went into negotiations, they did a match, but they also did a lump sum. The employer put in, $200,000 lump sum. And then started the 50-50 match, the 25-25 match.
Was that
Just the jump start. That's all up to you guys to do. Say that again?
They gave us the plan, this we gave that was.
No, so don't confuse leaving the city plan with the retiree pension benefit. Yeah, well, the $200,000 start was to jumpstart the investment so they wouldn't have to wait as long. They could shorten that maturing period.
Is that something, I know you said Peoria did it via the city, is that something just throwing out there is if we have union due or union monies that's available, can union monies as a lump sum start?
I'd have to go through the attorney.
Okay, but city wise, it's okay.
Probably, I will say yes, but the attorney, our trust attorney is brilliant. And I typically, because she's brilliant, say about her bunch of questions and hear it once because like $400 an hour. The princess and 5 emails, I'll just see what. You ain't, they can save it that time. Trust thanks for that. So that different things is.
I got to be steward to the mic. I got this.
Come out of court, jail. But once we get the regular administration part of it going, everybody contributes a small amount to offset that cost, to pay for that cost. The trust pays for itself, but it's very minimal. It's very minimal. And it's based on size. I mean, you can literally break it down to a per member per month amount. You know what I mean? And it's next to nothing.
I don't know if it's worth it.
Any other questions? What I was saying is that don't confuse the healthcare plan when we separated the city to go off on our own healthcare. To this pension benefit, this benefit pension benefit doesn't require you to separate.
Yes, that's just.
Yeah, that's just benefit, like your deferred comp benefit. Like, the other thing you know.
So yeah.
They haven't benefit,
TV.
I guess. It's the issue I have. And this is my opinion, my insurance is regulated state by state. It is hard to get everything to everybody nationally. Does that make sense? I mean, especially if you just take Medicare. That's the Medicare market in Arizona is 180 is different from the market. You know what I mean? It's hard to compete here because there's great Medicare market deals here. We have a high retirement. We got to sustain. And then they have their own state regulations and their own, you know. I would do it different way. But that's just me, I'm not an expert, I'm just doing about saying that. So there are ways to leverage that. Now, I haven't approached to do anything like that. But there are ways to do what we're doing and plug and play in state to state. Instead of one trust, on the premise of state of 50 trusts. And then you leverage marketing agreements with the big providers. You say, hey, we'll put some places out for bid. You have to go for that deal, but we'll work you $6 million a year. You know what I mean? It's really simpler than what they're doing now. Right now, they're trying to run a healthcare. They're trying to beat issue product. That's so hard. That's a lot of work. And you lose your local control. Prime example. You guys have doctor offices and you don't want to lose. You know what I mean? When you're a national deal. Whereas if you're oversees your trust, you know, for us, it's X number of departments. We have more leeway in customizing what's right for our members, as opposed to trying to influence a national organization that needs to do the same thing in Alabama as they have to do in Arizona, and customizing is like, okay, well, you might as well just put a board and make those decisions, a local board that makes those decisions. Not a national board, you know, and a local board that's on the location of where the services are being provided. You know, for us, Vincere, you know, our healthcare plan, right? So if you retire, you go on your healthcare plan, you get a full Vincere cancer screening once every 3 years, right? For you and your spouse, right? That's the full body MRI, everything Vincere does. Well, it's not feasible for somebody from Colorado to come down and use Vincere. But Vincere is customized the program for a firefighter here. You know what I mean? Dr. Schuckel is the oncologist we have faith and trust in. He doesn't have the scalability to do the nation. Make sense?
Yeah.
We offer a thing called MSK Solutions, all global. If you were to join our trust, once a month, we get this text that you say it's coming. And it'll say you're United, the Arizona Firefighters Healthcare Trust, MSK survey. And we pay a monthly, like gym membership to physical therapy. And they'll send you a text that says, are you having any pain? Yes or no? If so, where? Do you want to see, is it affecting your sleep or work? Or do you want to see a physical therapist? Right? You said yes. Answer it however you want. They take that down, call you up, give you a number to call. You get free physical therapy, unlimited. You get to go. So our logic is what's the downstream savings? We can catch your cancer at stage 1, and we pay a little more money to catch it at stage 1. We're not saving money 3 years down the road. If you're having a twinge in your shoulder, and we can catch it when it's a twinge, and you go to physical therapy and it's better, or you're a candidate for Regenix instead of surgery, what's the downstream money you save? Yeah, you pay $35 a month for you to have access to a free physical therapist. But I believe if you had a shoulder replacement, that $35 a month is a drop in the bucket. And you're going to work longer because you're healthier, you're happier, you feel. Our retirees get the same employee assistance program as our actors, safety crisis. And so the mental behavioral health stuff. I don't know if many of you guys haven't retired yet, but I have multiple friends that retired that went into a really bad depression, thinking they were going into the best times of their life. One of them had a freaking condo on the beach. Says I'm at the beach every day and I've never been more depressed. Because they lost their purpose. They lost what they've been doing for 30 years. And they're like, no. And I tell you, this one guy told me he was on the verge of suicide, even for a hike in the mountains in the hills of San Diego, came across a ranch and was petting a horse. And the lady came up and said, oh, you like horses, da, da, da. And it was a equine therapy ranch for Navy SEALs when they come back. Oh, yeah. So he said, can I volunteer? He said it flipped his life. Because all of a sudden now he had a purpose, he had a reason to live. He had something he need. So that idleness is something that when that transition will to lose that behavioral health benefit, especially when it specializes in just public safety, just firefighting, and their dependents, what we go through. To me, that's gonna save money down the street because stress causes problems. You know what I mean? Stress wears your body out, makes you sick. It's all those things. So the idea that we're trying to do here is multiple. One is, let's get people so that when they get a phone call from somebody out of Yuma, call and says, hey, I want to get on your healthcare plan, can I get the benefit guy? Now, calls me back and says, that's 3 quarters of my pension check, I keep those parents. Wrong. It's like you shouldn't retire. You know? Well, it's sad. State plan, you have a really good copper plan out of the ACA. It's the option you can afford. So how do we get you the best health care? How do we afford it? You don't have sticker shock because you got a subsidy that knock off that expense. You got a premium benefit and pays for your residents to knock off that expense. You know, and we get a plan that's customized for you. Hopefully you were in the active group plan and all these things that we implemented, you retired healthier than most retirees. You become a less expensive retiree. We get you to 65 and we don't have to Medicare yet, but eventually we will. You like yourself.
As a retiree, can I opt into the medical plan?
Don't give an eye. You're in Arizona, tired Arizona government, perfect. Unfortunately, Vivos are made for union plans, government employees, and we tried all kinds of things, try to get it for rural metro budget thing, because you run the government. They're all correct. Well, it's sorry, it doesn't go that way.
Sorry.
There's a mechanism.
It's good to know.
This is another thing, it's pension.
Books. Oh, yeah. That's.
There's nothing of this. I think they get sold it, not the part that's on it. I got sold the second. Hard truck, so machine comes in. They didn't sell them in, so it's still ours.
Have you heard of that now? See.
Yeah, when I stepped aside.
I went to the house.
Yes, I snuck them, call me.
Yeah.
Tell me.
One is in the back, where it's comes in the roots, new ones that.
Perfect.
Let me help you along.
Site, and it off, get the website, for the kids, the health works. And, everything will be able to do will be on.
If I.
Or like, but it's, we're gonna go live. This may be. And then we'll be going to first will be provided. I don't know what that problem. And there's quite a
So as joining us independent on the city,
Yeah, that can be one of our only membership items, but we wanted to get some membership first, make sure that everybody was on board with the 100%. Look at the pension.
Pete, where you, are you looking at?
Oh, right. I tried on that sort of.
This
The opposite.
Oh,
That would be, but you guys.
nice. But there's a lot, it's confusing. But, the subsidy program, the pension benefit program is very simple. Think about it, just think about, you get a pension check every month. Based on how much you contributed to the plan, and you have to use the money back. Whatever those are. That's what I'm looking.
No, thank you so much. Yeah, just piggybacking, it's, if you contribute yours and get your money back, you gotta plant the seed now. This is like, what we're talking about is time in is our alley, so.
Let's say, you know, it's a tree. 30 years ago. It was a subdivision.
Yeah.
It's a tree, it's got growth.
We had it in our MOU since 2017, and we just never been able to agree with the city, so we feel as a board that this is one of the best options for this union days. It's tax-free, income tax-free, and so it's a great benefit for us. So that's why we're exploring options. We've also wanted to give you guys as much education as possible, because this will be money that is taken on your paychecks. But it's money that, again, that you will receive with interest if you get cashed out, or you receive via a monthly check for the rest of your life. So again, if money gets taken out of members' paychecks, you want to inform the membership the best that we can. That's why we've done previous practices about the PFFA subsidy plan. It's why Donnie Onward's here today to educate as much as we can about this wonderful benefit. So if there's nothing else, do you have any other questions online?
I'll leave my card, if anybody wants it, I don't get the presentation. Okay, DC Consulting, we do, lobbying, we've had a lobbying for appropriations. So if you guys, your city wants to buy a new fire truck or a little fire station, just get what they call congressionally directed spending. Collect for it, it's hard to get it, it's just an application. You kind of need a lobbyist to go there and tell your story. A lot of cities and a lot of fire districts put in money, put in the application, and they'll pass the first round, and when they get kicked out, when they get kicked out because they don't have any applications. But each congressman only gets 15. So senators, like, I think they get more based on the political top, so can't go over certain money. Whenever you hear about the federal budget being held up, it's always, the fight is always what's the appropriation spending. It's the total.
Yes, and
Appropriations only make up about less than, so it's not like if you cut out appropriations, the deficit would be solved. You can order music. I look at least, I'll stop me.
yeah.
Cheap portion. I think Karen's. But what appropriations do is they bring the tax dollars back to the district of that congressman or that senator. So it's really your tax dollars, you get early coming back. And so these certain congressmen say, I'm in no appropriation because we have done, they're really passing on the ability for their constituents' tax dollars to come back home. And it also forces the two parties to sit down and talk, because they keep pass a budget without agreeing on the appropriations. So it's one of those tools as well. But anyways, if you hear anything that you want, your city or looking for excess funding outside the city or outside AFG.
I guess our next step is if we get 100% participation rate for the membership, we have to go to city. If the city agrees to it, then do I give you a phone call?
Yeah.
And then we go from there and get after. Talk about like beneficiaries, for example.
Like I said, you
Okay.
set up based on The details of what you got.
Okay.
Some people vesting period was a big deal, clean your debit. You know, they don't get a really big benefit. But they're just, money didn't sit in there and mature, not pay out for years.
And that's something that the actuaries sit down and today. If it's a scenario basis, different benefits when it comes to like beneficiaries, years, okay.
All he does is really something.
They can benefit the evaluation.
We're bringing the MOU negotiations. Is there like a example form that we film like this is what kind of something like that? Like discussion points where we can.
Contribution rates. Groups that are. And get you to the, and you can. Actual evaluations call, I mean. They want to see those, man, you go.
Maybe a similar sized city.
Say, you guys, how many numbers you have?
61 rands.
61.
We're gonna have 65.
Well, we're gonna have 100 in 2 years.
Yeah, 100.
So, you know, it's, the size matters. It's, you know, it's more money to get invested.
Okay.
But, one of the things we thought about is, you know, if we partner with another. Groups, you know, not just, you know, say that we're firefighting, say, hey, we're gonna do a joint, we agree on the same contribution, we agree on all this with it. Now there's 200 of them. You know what I mean? You just, you lose a little bit of. Work, you know.
Yeah.
So maybe you ever done it? It can be done.
Okay.
It takes cooperation from both cities.
No, if you can give us an example around a 60 membership agreement, if really.
Yeah, I'm trying to think of the way to have to see. So, I don't know. Our smallest group, we. Increase.
Yeah, there's some.
Figures are 100.
Goodyear would be a great example for strategy that the years would be, just so we can give the city more educated. Be awesome.
Yeah, like I said, that's the, this is what they're doing.
Okay.
You know, so that's a lot. Cool.
Cool. Thank you so much.